Biomarkers of sepsis. Introduction. Sepsis, a life-threatening condition caused by a dysregulated immune response to infection, leads to systemic inflammation, organ dysfunction, and high mortality. Early diagnosis and timely intervention are essential for improving outcomes. However, the nonspecific symptoms of sepsis complicate its diagnosis. Biomarkers are crucial tools in diagnosing, monitoring, and predicting the prognosis of sepsis. They help distinguish sepsis from other inflammatory conditions, assess disease severity, and guide therapeutic decisions. Commonly used biomarkers include C-reactive protein, CRP, procalcitonin, PCT, and lactate, while emerging biomarkers offer potential for improved accuracy. Common biomarkers in sepsis: 1. C-reactive protein, CRP. Description: acute phase protein produced by the liver in response to systemic inflammation. Role: elevated within 6 to 12 hours of infection onset, indicating inflammation but not specific to sepsis. Clinical use: often used alongside other markers to monitor treatment response. 2. Procalcitonin, PCT. Description: precursor of calcitonin, rising significantly in bacterial infections. Role: increases within 2 to 4 hours of bacterial infection, correlating with disease severity. Clinical use: differentiates bacterial sepsis from other conditions, guides antibiotic therapy, and predicts complications. Lactate. Description: byproduct of anaerobic metabolism, indicating tissue hypoxia. Elevated levels: 2 millimole suggest tissue hypoperfusion. Levels 4 millimole per liter indicate high mortality risk. Clinical use: a prognostic marker used to monitor resuscitation efforts and guide fluid therapy. Emerging biomarkers in sepsis. 1. Interleukin-6, IL-scription, pro-inflammatory cytokine linked to immune response severity. Role: early marker of inflammation. Higher levels indicate worse outcomes. Clinical use: potential diagnostic tool for early sepsis detection. 2. Soluble triggering receptor expressed on myeloid cells 1, S-TRIM1. Description: amplifies inflammatory responses in bacterial and fungal infections. Role: elevated levels distinguish sepsis from non-infectious inflammation. Clinical use: promising but requires further validation for routine use. HAC3, presepsin, SCD4-est, soluble fragment of CD14 involved in bacterial immune response. Role: correlates with disease severity in bacterial sepsis. Clinical use: diagnostic and prognostic tool for early sepsis detection. PA4, proadrenomedulin, pro-ADM. Description: precursor to adrenomedulin, involved in vascular tone regulation. Role: indicates vascular dysfunction and organ failure, correlating with poor outcomes. Clinical use: assesses sepsis severity and mortality risk when used with other biomarkers. Conclusion: biomarkers such as CRP, PCT, and lactate are pivotal in sepsis management, providing insights into inflammation, infection, and perfusion status. Emerging markers like IL-6, STREM1, presepsin, and ProADM show promise for enhancing diagnostic precision and prognostication. Integrating biomarker panels into clinical practice could enable personalized treatment, improving outcomes in sepsis patients. This version